I'm Jackie Manthorne, President and CEO of the Canadian Cancer Survivor Network, and this is Conrad Eder, who is our public policy analyst. Leger, on behalf of the Canadian Cancer Survivor Network, conducted a survey to assess the extent to which the disruption of cancer care caused by COVID-19 is impacting cancer patients and caregivers from an emotional and physical wellness perspective.
Our COVID-19 and cancer care survey looked at the following key topics. We asked, have appointments been canceled or rescheduled? And we found that more than 50% of patients, pre-diagnosis patients, and caregivers had their appointments canceled, rescheduled, or postponed. Even further, we wanted to get a sense of why were those appointments put off. In many cases, it was as a result of the doctors forcing the cancellation or postponement. But we did find that 40% of pre-diagnosis patients chose to put off appointments with their general practitioner or oncologist out of fear of entering a hospital or healthcare setting. We also looked at whether or not patients had incurred delays in their diagnosis. We asked questions like whether or not patients were still waiting for tests. Unfortunately, we found that more than 30% of pre-diagnosis patients were still waiting for biopsy reports or ultrasound reports to be sent to them or for the diagnostic test to even be completed. We asked patients whether or not they felt comfortable entering the ER, even if they were experiencing cancer-related symptoms. Unfortunately, we found that more than 40% of pre-diagnosis patients, even if they were feeling cancer-related symptoms, did not feel comfortable entering the ER setting to receive care. We also asked whether or not patients lost or had their private health insurance benefits reduced over the course of COVID-19. We asked specifically whether or not they felt concerned about being able to fill prescriptions during the course of the pandemic. We asked what was the emotional and mental impact of diagnosis and treatments being delayed over the course of COVID-19. Our survey results show that 5 in 10 respondents said they were very or somewhat anxious as a result of diagnosis and treatment delays. But if you isolate those numbers and look specifically at metastatic patients and pre-diagnosis patients, we found that 7 in 10 were very or somewhat anxious about their diagnostic testing or treatment being delayed. We also examined how patients and caregivers interacted with their doctor. Of those who were able to get in touch with their general practitioner or oncologist, only 20% were able to do so in person. The vast majority, approximately 80%, were only able to reach them over the phone, with very few consultations taking place over a virtual platform. Finally, we asked whether or not clinical trials had been impacted over the course of COVID-19. Specifically looking at patients, we found that 31% of those patients who were currently enrolled in a clinical trial had their clinical trials put on hold. But even further, 12% had those clinical trials canceled altogether.
And now a word about methodology. We conducted a 10-minute online survey in English and French from May 22nd to June 10th, 2020. There were 960 Canadians diagnosed with cancer, 206 caregivers, and 77 Canadians who were waiting for their diagnosis to find out whether they had cancer or not. All in all, we had 1,243 patients, caregivers, and those awaiting diagnosis. Taken together nationally, results were statistically significant. Among patients, they were pretty evenly spread by gender, 52% female, 48% male. 2/3 of patients had breast, prostate, lung, or colorectal cancer. 1/3 of patients were in remission, 10% had metastatic disease, and most had adjuvant disease. caregivers were skewed towards females, 60% versus 40% males.
Next, I'd like to go over the key results from our COVID-19 and cancer care survey. We have 4 key findings that I'd like to review. The first, we found that there is a considerable disruption to many aspects of cancer care in Canada. More than half of cancer patients, their caregivers, and those awaiting a confirmation of a cancer diagnosis report appointments cancelled, postponed, or rescheduled, while 85% of recently diagnosed patients and 74% of those awaiting a diagnosis reported experiencing cancelled, postponed, or rescheduled appointments. Our second key result is that virtual healthcare has largely replaced in-person visits during the pandemic. Of those who were able to interact with a physician during the pandemic, 83% did so typically over the phone. Almost 3/4 of cancer patients, pre-diagnosis patients, and caregivers remain concerned about the ability to access in-person care. And that includes being cared for in a hospital or emergency room setting, as well as the ability to receive tests and treatment. Third, we wanted to examine the mental and emotional toll that has been on cancer patients, pre-diagnosis patients, and caregivers. And clearly, we found that that toll has been considerable. The majority of those who experience delays in appointments and treatments, about 74%, say that these delays have had a major impact on their mental and emotional health. Among those who experience delays, caregivers and those awaiting a diagnosis were significantly more likely to report being mentally or emotionally impacted, nearly 90%. And finally, fourth, we found that there are still broad concerns about the ability to receive adequate cancer care, and it continues to fuel anxieties. We found that 52% of survey respondents said that they are concerned about being able to schedule appointments and receive treatment in a timely fashion. Further, 70% of patients awaiting a diagnosis are concerned about delays in diagnostic testing and procedures.
We would like to thank all the cancer patients, caregivers, and those in the process of being diagnosed who took the time to complete our COVID-19 and Cancer Care Disruption in Canada survey, as well as those who told CCSN about their thoughts and feelings about cancer care disruption. Here are some of the quotes that we've taken from our survey.
This is a quote from a stage 2 breast cancer, leukemia, and lung cancer patient from Ontario. They wrote, "First, I would like to say no one should have any cancer appointments canceled or rescheduled. This is cancer. If you have it, it could or perhaps it already has spread. Not having my treatments is a nightmare. All you keep doing in your head is asking yourself, has it spread? Am I going to die sooner, or will I make it to my next appointment? I'm afraid I might get COVID-19 and die. I'm concerned for my future. I want to see my family again so I can hug and kiss them."
Cancer can't wait. This quote is from a lymphedema survivor from Alberta. "My principal cancer is a lymphoma, which is in remission. I have also had skin cancer, which has successfully been treated surgically in an outpatient setting. I am exasperated, though, at having a colonoscopy postponed to rule out rectal or colon cancer and to try to determine why my iron count is perpetually low. Not only was the colonoscopy canceled, the doctor was close to retirement, closed his practice, and forced me to the bottom of the wait list."
Cancer can't wait.
A stage 4 osteosarcoma patient from Nova Scotia. "Fear that if I needed an operation or treatment, I would not be admitted into hospital and that it would be delayed until it was too late. That if I was admitted, my family would be unable to see me and I would struggle to deal with it on my own. Or worse, if my cancer had spread too far and I was going to die, I would have to die alone in hospital and not have my family around me.
Cancer can't wait.
This is a quote from a breast, kidney, and pancreatic cancer patient from Ontario. It's already hard to manage the anxiety that comes with cancer, but not knowing when you'll be able to follow up with your doctor amplifies that. Although telephone appointments are safer than exposing us to COVID-19, they are not very effective for communicating symptoms and examining changes to help.
Cancer can't wait.
This is from a stage 2 stomach cancer patient living in Quebec. Having my endoscopy procedure postponed has increased my worries. Now I have to wait, and I have no idea when it will be rescheduled. I want to know that my cancer treatment was successful and that the cancer has not returned. This uncertainty is affecting my quality of sleep. I need to know if my cancer has come back, and if it takes come back, how long will I need to wait? The longer it takes the cancer, if it has come back, the cancer will grow.
Cancer can't wait. This is from a stage 4 breast cancer patient from Newfoundland and Labrador. Where I am stage 4, it is concerning that I may have a scan postponed because of the pandemic. It makes me worry that something might be growing that we aren't going to catch in time due to lack of scanning. So it's causing a lot of anxiety.
Cancer can't wait.
This is a quote from a breast cancer, colon cancer, and rectal cancer survivor most recently diagnosed with thyroid cancer, and her husband, who was diagnosed with multiple myeloma, living in British Columbia. Personally, I think more people will die from disease unrelated to COVID as we cannot see a doctor personally. My husband has multiple myeloma, and I finally insisted on seeing the oncologist last week. He is doing very poorly and was actually taken off chemo for a month after we met face to face. I have been telling them by phone, how can you help us if you don't see him? How is a conversation on the phone going to help? My doctor that has treated me for thyroid cancer canceled my appointment last April. I'm not that concerned as I had surgery to remove my thyroid and had radiation. So far everything is okay, I hope.
Cancer can't wait. This is from a stage 1 cervical cancer patient from Manitoba. I am supposed to have testing done at every appointment. I have been put off 3 times since COVID-19 started. I'm worried that I may still have growing cells.
Cancer can't wait.
Cancer can't wait. The delay and cancellation of cancer care due to COVID-19 has triggered another public health crisis in Canada. Our survey revealed that the response to the COVID-19 pandemic has led to a crisis in essential cancer care across the country. Cancer patients, their caregivers, and those awaiting confirmation of a cancer diagnosis are facing postponed and canceled appointments, tests, and treatments, causing heightened fears and anxiety. And that was before the recent upswing in daily cases. To save lives, cancer care and diagnosis must continue during any public health crisis affecting Canadians. Safe and timely access to cancer care, including diagnostics, testing, and treatment, must remain a top priority in Canada during any public health crisis. Federal, provincial, and territorial governments must ensure that sustained provision of essential cancer care is included in any crisis or pandemic planning. Thank you very much.